this computer. All right, we
All right.
are going.
Cool. Hi, everyone. So I'm Lacey Dickerson. I'm the educator at Canandaigua Planned Parenthood. And the other face you see is Danielle Donofrio. She's educator at the Rochester Planned Parenthood. We're going to talk about a little bit about Pride and some services we offer as well. The folks who are planning the Finger Lakes Pride sent us over some questions already pre-written. So we're going to talk about those as well. But first, I want to talk about what Planned Parenthood is and kind of our mission. So we're proud to provide reproductive health care services for all. It doesn't matter where you come from, it doesn't matter if you can't pay, you're going to be seen, you're going to be cared for. We provide high quality, non-judgmental reproductive health care. We promote responsible and healthy sexuality. So that basically means we educate what Danielle and I do are we educate people on birth control, healthy sexuality choices. We also advocate for access to comprehensive health care and support those affected by sexual violence. Planned Parenthood has a program called Restore that operates in the Glow community as well as Monroe County. The sexual violence organization for Finger Lakes would be Safe Harbors. You can get that information online, or you can email me. I can gladly get you that information as well. We're the most trusted and reliable source for service and information regarding sexuality and reproductive health, and we cover all the way from Buffalo to Syracuse and everywhere in between. So we cover a really wide county area.
All right, so the first question that we got is, what does Pride mean to you? So just our little blurb is, Pride is about celebrating our love and uniqueness and honoring those who fought before us. So people like Marsha P. Johnson, she was a Black transgender woman who was a leader in the LGBTQ community for activism. She was also one of the many queer people, the many Black trans queer people who helped during the Stonewall riots against the discrimination and brutality that was happening against LGBTQ people. Personally, Pride is about community. It's somewhere where you go and you feel like you instantly belong because you are no longer the odd man out or the odd person out. You feel like, oh my gosh, these people are like me. They understand. Personally, from my first Pride in my youth, it was the most moving, exciting experience I can tell you about. To be in a community. Oh, wow, I'm getting choked up.
Oh, that's okay. Well, I'll take over. For Pride for me is all about being an ally for those who are out and even those who aren't out yet, whether that be for their own safety or they just aren't comfortable yet. Marching with them, being with them, showing my support for them, having a safe zone for them if they need somewhere to go, if they're kicked out for coming out, my house is always open. Even, the other 11 months out of the year. It's always just being a great ally and just showing them the support that they need. So that's what Pride means to me. So yeah, are we okay to move on? You good? Yeah. Okay, good. So some different specific LGBTQ plus services we provide are, HIV counseling, HIV prevention and PrEP. We do prescribe PrEP at Planned Parenthood. We do contraceptive counseling. So if somebody does want to come in and get on birth control, we do that as well. At the Canandaigua location and Syracuse location, we do gender affirming hormone therapy and gynecological care as well, and also STD testing. So we do it all. Yeah.
Cool. So our next question, are walk-in appointments accepted or only by appointment? Are all staff trained in LGBTQ related health? So let's address the first part, the walk-ins. So Sometimes walk-ins are accepted if we have the time in the clinic. We can't always predict that, so we always say to go ahead and make an appointment. Right now with COVID happening and the pandemic, we are only doing telehealth, so nobody's really coming into our clinics. Telehealth has actually been very helpful for people who have transportation issues, and we do telehealth all year round. It's just there's been an uptick right now because of the pandemic. And yes, our staff is trained in LGBTQ related issues. A lot of staff, including myself, are trained in safe zones and safe zone training. And we actually go around to other community partners and schools in the area and actually do LGBTQ related health and training so that people are aware of the different needs that LGBTQ people need in the health field.
Cool. So the next question that was sent to us was, does Planned Parenthood, or what does Planned Parenthood do to ensure the use of patients' true names and pronouns? So at the Canandaigua location, I can speak to specifically, but I'm like 99% sure they do this at all locations. The health center staff, they ask patients their name and pronouns beforehand when they come into the little window that they meet at. When they first walk in, and then they make a note in their chart to alert staff. However, sometimes patients do ask the front staff to relay it back to the health center staff to use their legal name for safety purposes when they call them back to the health center clinic part. So we do that, but then there's always a note in the chart to call the patient by their real name or the name that they want to be called, and also their pronouns. So we're ensuring their safety as well as their true identity.
All right, so our next question was about confidentiality. So what does confidentiality look like at Planned Parenthood? So confidentiality is super, super important to us. We have to comply with HIPAA, which basically says that we can't give out any sort of information without the patient's consent. So we understand the severity and the importance, not just of confidentiality, but the importance of not outing our patients as well. Like Lacey was talking about in our previous slide about how some patients ask for their legal name for safety purposes. We understand that there is a lot of safety issues with outing somebody, not just physical safety, but emotional safety needs as well. So we want to make sure that we're respecting that and that we're not breaking any sort of confidentiality in violation of HIPAA or violating anything that our patients don't feel like should be shared.
The next question was, are there any conditions that would require the involvement or contact of a parent or guardian? So this is a hard no unless a patient has given previous consent for a patient or a parent, or guardian to receive medical information. Or if there is like some kind of emergency, then they need an explicit note to say that, this person is allowed to be contacted as an emergency contact. Other than that, everything is confidential. We pride ourselves in our confidentiality at Planned Parenthood. So whatever is said in those doors stays within those doors, and whatever care you get stays within those doors as well.
And with our services as well, as we'll talk about more about our hormone gender affirming therapy. But with all of our services for anyone of any sexual orientation, we do not need parent consent. With the laws of minor reproductive rights, anybody can come into our doors and ask for services, and we do not need to get parental consent for that.
Yup.
So, is Planned Parenthood able to prescribe hormones or hormone blockers to trans youth under 18? And if so, what does that process look like for them? At this time, Planned Parenthood, like we said, is only doing transgender care in our Canandaigua and Syracuse locations for the gender affirming hormone therapy. But we are not prescribing those to anybody under the age of 18. You can only be 18 to get your hormones and your hormone blockers. You don't need a letter of consent from anybody. You don't need a pre-existing prescription. Planned Parenthood can take care of all of that. The only requirement that we have right now is that you be over the age of 18.
The next one is, do you provide any services or information for questioning trans youth? So on the slide, I have some things, some links that are copy and pasted that may be of use. If I know this is pre-recorded, so if you want, you can pause and then, type it into your URL. These are some really, really good, links to have for some trans youth. There's some information on there about some meetups. I don't know if they're still happening with COVID. That specific one I'm talking about right now is the last one it has the fcsfl.org one. But if youth are questioning anything, especially trans youth, we do give resources. If it's something that we can't help them with, we do refer out, and we do give them some support groups as well, so they can be always supported in the choices that they want to make, and have allies with them.
All right, our next question. Does one have to be below a certain age to be prescribed hormones, or can older populations transition with hormones? How will this effect differ? So at Planned Parenthood, you just need to be at least 18. There is no age cap. Hormones do affect each person differently, so there may be variables that affect different people, but you should have an open and honest conversation with your doctor and see, what different things maybe you might be at risk for, or that might be more inclined to affect you differently with hormones. So as for side effects go. Yeah.
The next one is, how much do differing services cost? And then what if an individual, youth or otherwise, cannot afford these services? So it really depends on your insurance provider, if services are completely covered. I always tell people to call ahead and, talk to our call center staff. They're really great people and they know a lot about insurance. Planned Parenthood also works on a sliding scale and will work with you to help cover costs if you don't have insurance. Another great program that Planned Parenthood has is the Family Planning Benefit Program. This covers things like STD testing, HIV testing and counseling, and birth control. You just need to be a New York State resident and 16 years or older to qualify for this. Other than that, we'll work with you. You'll never not be cared for or seen at Planned Parenthood just because you can't afford to, have like an STI test or a birth control birth control service. So you'll always be seen no matter what.
All right, who can I talk to when I'm feeling uncomfortable about my body? All right, so feeling uncomfortable about your body is normal and natural, unfortunately. I think we all kind of go through it. But once it's reaching the level of where you feel sort of like dysmorphia and hatred towards your body, or feeling like you are in the wrong body, then we need to seek out a healthcare professional. So making sure that we can get you to properly trained staff and people to make sure that we're keeping you in a healthy and safe environment. So always, again, be open and honest with your healthcare providers if you're having these feelings or thoughts, and also find somebody that you trust to talk to as well. Maybe it's hard to talk to your healthcare provider at first. You can absolutely always come in to any of our health centers that have our educators in them, like our Canandaigua location. Lacey has office hours there where you can come in and talk to her about whatever it is, whether it be how you're feeling uncomfortable, if you have questions about our services. Our educators are there on the healthcare centers to make sure that we can help you all and help you become more confident and educated and knowledgeable about our services and more comfortable in your own body.
Mm-hmm. So the next one is, when entering a sexual relationship, how can we talk about their body and ensure safe boundaries without triggering body dysmorphia? So whenever you're entering any type of relationship, whether it be sexual or, just a friendly relationship, or it's a brand new relationship and you're exploring whatever, communication is very, very important, especially entering a sexual relationship with somebody who may be trans, or even if it's just like a heterosexual relationship. Mirroring language that your partner uses about their body can help make both of you comfortable, especially when it comes down to, getting in like a sexual activity. It's really important to establish boundaries before engaging in any type of sexual activity and staying within those boundaries. So having a healthy communication style, whether that's sitting down face to face, having the conversation over the phone, FaceTime, since we are in, a pandemic, whatever works for you and whatever you are most comfortable with, communication is key. Be open and honest about how you're feeling, and hopefully your partner is open and honest about how they're feeling, and create that environment to hopefully welcome them to be open and honest. And I guess that would just be my advice, is just communication and open and honesty. Yeah.
Yeah, I think the big thing too is the mirroring language. If you know that your partner has issues with certain names for their body parts, don't use those names. Mirror whatever language that they have used. If they just feel comfortable saying genitals, make sure you refer to them as their genitals and let them take the lead. Or say things like, I'm really interested in exploring a sexual relationship with you. How do you feel about that? Can we talk about that some more? And let them lead the conversation. Ask them questions. Would you be comfortable if I touched this? I would be comfortable if you touched that. And then also having an open and honest conversation about STD testing. That's something that we all need to think about and all need to be aware of. I've talked to a lot of LGBTQ youth who don't believe that they need to wear condoms of any sort, internal or external, or dental dams, because LGBTQ youth have this idea that, we can't get pregnant, so we don't need any sort of condoms or barrier methods. While STDs are very, very high, specifically HIV in the gay male community and the gay male community of color, or the men who sleep with men community. So we really want to be conscious and have a full rounded conversation with our partners.
Mm-hmm.
All right, so Pride parades and such might be canceled right now, but sorry, just moving Lacey and I about so y'all can see as much as possible. Mm-hmm. So even though Prides are canceled this year, we still can celebrate Prides, even though going out and to the parades and going out with our community and being physically around each other, we're not allowed to do that because of the pandemic. We still can celebrate Pride and get involved. So what we've done here at Planned Parenthood is we've done letters of Pride. So basically what that means is we can write letters or notes in support of our LGBTQ selves, of our community, of, if we're an ally, we can be involved, even if we're not out yet. Pride is for everybody. So we want to do that and include everyone. So what we've done, and I'm gonna, Lacey, actually, can you hit the link because I can't?
Yeah.
So just to give you all an idea of what these letters of Pride would look like, they have been shared so far by a lot of our staff, by a lot of our youth as well that we work with, to go ahead and share these letters of Pride. Because even though we can't be together, Pride is never canceled. It's about, like I said earlier, about celebrating our uniqueness and everything that has come before us, and celebrating us as a community, and feeling that sense of community, as you all saw earlier, was very overwhelming. And thinking back to that first experience. So go ahead whenever you're ready, Lacey, you can click on that link.
Oh, I did. You can't see it?
Oh, you have to share that screen.
Oh, okay. Hold on. I thought I did. I was going down and everything.
I love it. Bear with us. Even though we are millennials, we are not the best at technology either.
Yep. Can you see it now?
Letters of Pride. So we even have some coloring from our very young youth. We have some very artsy stuff. The future is inclusive. You are love. Love is love. These things are so meaningful and so powerful to people to just see these letters of support. So what we ask you to do is go ahead and write your own letter of support. Whatever your message is, whatever you want to do, it could be as simple as a rainbow, or it could be a note to, you know, our LGBTQ youth or people struggling, you know. Some people have signed them, but they can be anonymous as well. And if we go back to our slide, it has the email address where you can send these letters of pride to.
Can you see that?
We can't be in person, pride doesn't stop. You know, we're celebrating pride every day. So yep, pride at ppcwny.org. So we'll leave that up, and you guys can just make your letters of pride, do whatever you want to do, be supportive, spread the love, spread pride.
Yeah, I love that. But yeah, if anybody,
yeah, go ahead.
Oh, if anybody has any other questions, you can reach me or Danielle via email, or it's just our first and last names. You can find them at the beginning of PowerPoint at ppcwny.org. And we'll be happy to answer you guys no matter what. We're always here for you. And yeah, I hope everybody has a happy Pride. And yeah, I love everybody. So
yay. Pride, y'all.